everybody, good evening. Welcome to tonight's episode. My name is Dr. Doris and this is EyeCare Online episode 17. Wow, we are really trying, right? What that means is that for 17 Mondays, I have been in front of you guys sharing information, creating awareness. Oh, you can hear me very well. Oh, thank you so much. Thank you. Now I can speak more confidently, right? All right, so tonight is going to be quite pretty simple, straightforward. I'm not going to take much questions tonight, but still feel free to ask your question. I may take them, okay? But I want to share a couple of things that I believe we need to know about. We need to, learn about based on a couple of things that happened. Okay, so let's start with the topic. The topic is what not to put in your eyes. I mean, it's very self-explanatory. It's very simple to understand, but it will amaze us how many of us don't really get it, right? Like many of us don't really get that. We look at the eyes. The eyes are arguably one of the most important organs of the body. Without sight, without vision, can you just imagine what life can look like? Keep your eyes closed and just imagine how life can be if you don't see, if you are not seeing. And yet these beautiful organs that God has given to us, many of us don't really regard them as anything. We handle them anyhow. We put things in them anyhow. So tonight we're going to be talking about a couple of things, the things that we overlook a lot, that we are not supposed to put in our eyes. Right, the program is EyeCare Online. It's all about eye health, all about eye care awareness. So I'm going to be driving home some points on what we should not put in our eyes. I think I'm big. Someone just told me that I'm starting a bit earlier, right? But it's good, right? Better earlier than late. Okay, so the first thing I want us to look at that we should not put in our eye are our fingers. Our fingers, our hands are not meant for our eyes. As funny as it may sound, can you imagine, like, many of us go through our day without even realizing that we're rubbing our eyes. Any small thing, we just put our we can do like this, remove lashes, do this. We are putting our fingers, these fingers that have been shaking people's hands, that have been on different surfaces, that have been touching different things. And it's not that we always wash our hands before putting our hands in our eyes. Sometimes out of reflex, your eye is itching you. Many of us complain about itching. And when the eye is itching you, what do? You take your hands and you try to scratch your eyes. We are not meant to put your hands in your eye. Because when you put your hands in your eye or your fingers in your eye, some of us do like this. When you do that, you're transferring germs from your hands, from your fingers into your eyes. And when you do that, your eyes get infected. That's when you have things like Apollo, you have other infections. Apollo is the most common I can think of right now. And I remember growing up, they used to tell us that time that if someone has Apollo, I look at the person's, eyeball to eyeball, you transfer it to your eye. That's not true. What actually happened is that someone that has Apollo, because when people have Apollo, they have those discharges, those whitish things, the tears come out, right? Now, the people will use their hands and clean and wipe their eyes. Okay, now when they finish wiping their eyes, they can keep it on a table or they can rub it on their clothes. And then, of course, when they rub it on their clothes, rub their hands on their clothes, it doesn't wipe away the bacteria, right? Because Apollo is actually a bacterial conjunctivitis, so they don't wipe it away. And then they now shake you with that hand. Then you now take that hand and touch your own eye. When you do that, that is when you contract the Apollo. It's not by looking at somebody eyeball to eyeball. So when you put those hands in your eye and then your eye gets infected, that's when you feel things like as if there's sand in your eye, the discharge starts coming out of your own eye. Discharges most times are the first sign of infection. And this infection got into your eye, not by magic. It got into your eye by transfer, by contact. And then that contact most times is you, because nobody will take their own hands and put in your own eye. So the first thing that we should not put in our eyes are our hands. Okay, it's very important don't touch your eyes. No matter how tempting it is to scratch your eye, if your eye is itching you, find out what is causing my eye to itch me. I talked about itching eye. There are different reasons why your eye can be itching you. Or first of all, it could be due to an allergy, or it could be due to a refractive error. Either way, you need to identify, why am I having itchy eyes, and take care of it. Scratching it does not stop the itching. It just make you feel better for a few seconds, and once you stop scratching, it becomes painful. We all know that. So the first thing is, please avoid touching your eyes. Now, the second thing that we should not put into our eyes are other people's eye drops. You will not believe me how many times I've heard somebody say, I used my husband's eye drop, or my mother instilled her eye drop. You're laughing, but that's the truth. See, when you go to an eye clinic, in the course of taking your case history, of trying to know what your problem is, we ask you certain questions, such as, do you have any systemic problem? What we mean is, do you have things like hypertension, diabetes? Do you suffer from ulcer? Are you asthmatic? We also ask questions like, are you allergic to anything? And by anything, we don't just mean any eye drop. Sometimes you have people that are allergic to ibuprofen, which is a tablet. You have people that are allergic to normal analgesic. We have had different allergies. We ask all those questions because there are some eye drops that are not meant for asthmatic patients that other patients can use. For example, you have an eye drop that, let's say two of us, we have similar symptoms. We both experience eye pain, but I'm asthmatic and you are not. They can't give us the same drug. They can't, because they have to put into consideration your systemic health. Some of us, okay, let's say for example, I don't know if you have used an eye drop that you felt the taste in your throat. Like you put the eye drop in your eye and you felt the taste. That's to show you that there is a connection between your eye, your nose, your throat, and that means into your system. Which is the same reason why women that are pregnant or breastfeeding, we don't just give them eye drops. We have to weigh the benefits and the risk. I've heard a patient tell me, but it's just eye drop now. What effect will it have in my system? A lot. There are certain drugs eye drop that if you use as an asthmatic patient, you go into serious crisis. There are certain eye drops that if you have hypertension or diabetes, you go into serious crisis. Now, I have seen people say, I used my husband's eye drop. I used my wife's eye drop. Why would you do that? The doctor prescribed a certain eye drop for a certain ailment at a certain time for a certain patient, not for you. Or somebody said, I recommended this eye drop for this person because when I had the similar issue, that was what I used. That thing has ruined many eyesight, more than, I don't know. It's bad. Every treatment is unique. Every treatment is tailored to a patient. That's why we take time to ask all those questions. Please do not instill. I have been called one night because of a patient's crisis. A patient who is not my patient. My patient called me for, will I call it her own patient? You can imagine that. My patient, I gave an eye drop, carried the eye drop and gave somebody who is not my patient, and the person had crisis, and now my patient called me to intervene a person I don't know her medical history. So please do not instill somebody else's eye drop into your own eye. Don't. The third category of things you should not put in your eye is eye drop that is not prescribed by a physician. Let me rephrase that. Eye drop that is not prescribed by an eye doctor. Do not put that into your eye. The first one is, don't put an eye drop prescribed by a neighbor, right? Or a neighbor or a well-meaning somebody. The second one is, don't put an eye drop that is not prescribed by an eye doctor. Now, many of us have this thing, anytime we have a problem, our first port of call is the pharmacy, the chemist. That's a fact. I understand that. I have seen a situation whereby somebody had an allergy, itching of the eye. The person was beginning to have this, was having this symptom of Apollo, conjunctivitis, right? And the person went to a pharmacy, and the pharmacy prescribed the same glaucoma drug, different brand. Like if you know how you have Emza paracetamol and another paracetamol, right? Like the same paracetamol, different brand. The pharmacy prescribed the same glaucoma drug, different brand, and then a steroid. Do you understand? So now that is what they prescribe for this person that is having this sense of sandy and all that. How does that help the person? The person does not have glaucoma. The person simply have, eye itching. Why prescribing the wrong medication for the person? So, it is my plea to you. There are many eye clinics, like we have a lot of them. Reputable, licensed one. And I keep saying, if you don't know where to go, I am in Akwa Ibom, you don't have to come to me. I am very far. If you're in Lagos, if you're in Abuja, if you're in Port Harcourt, I admit I am far. But I have colleagues whom I trust, I know very well, licensed, reputable in all over Nigeria, and I'm trying to get more outside Nigeria. Send me a message and I will direct you to the one closest to you. Like I said earlier, the eyes are sensitive organs. There is no eye bank anyway. You cannot do eye transplant right now. Maybe in the future we can. Now we can't. So please, let's be careful what we instill. So the first one I said is, do not touch your eyes with your hands. Second one, do not use any eye drop prescribed by your neighbor or women in Nigerians. The third one, do not instill any eye drop that is not prescribed by your eye doctor. Now the fourth one is, I don't even know, I'm going to group the fourth one because I'm going to just go through them. Do not instill urine into your eye, please. Do not instill. See that thing they say, wash with first urine, wash your eyes. And the annoying thing is that I say these things mostly in cases that are so minor, like cases that with less than 1,000 naira you can handle, sometimes even 100 naira you can handle them. But I've seen people like do things that leave me amazed. Do not wash your face with first urine or anything, please. If you wake up and you feel and you see discharges in your eye, do not wash your face with first urine, whether first, second, or third. I don't know which number again. Because if you have an infection in your system that you are not aware of, let's say for example you have gonorrhea, your urine is infected, and you wash your face with that, or you instill in your eyes, whichever one they advise you to do. Please don't do it. Because when you do, the problem becomes more than it's supposed to be. Do not instill urine. Do not instill onions. I cook. I love cooking. And I cut onions. And I know that just cutting onions alone makes me tear. Now, can you imagine somebody cutting onions and instilling the onion fluid into their eyes? Can you imagine that? I've seen such a case. And then the one I wrote about one day, a couple of months ago, aboniki for itching. I talked about this earlier. I talked about ways you can get relief. Home remedy. You can get relief from itching. It's as simple as pouring water on your face. Cool water. Water will just cool at least that itching. For that particular time, you get that relief. Imagine somebody applying aboniki under their lid to take care of itching. Of course, you can imagine how that, just go with me here, flow with me. You can imagine how bad that was. But that has happened. So things like that, urine, onions, aboniki, don't instill them into your eyes. All right? Don't instill them into your eyes. Okay? Now, the last one I want to talk about, which is what inspired this whole life, this topic. This was not the original topic, but an event happened. Last week, I had a patient, 25-year-old girl, that came into the clinic. And the same complaint as if there's something in my eye was itching me, slight pain, woke up in the morning, I had discharges and all that and all that. And then a friend advised her to put a leaf, get leaf. Up to today I still don't know the leaf exactly, but to get a leaf, bring out the fluid from the leaf and instill in her eyes. And that is how this 25-year-old girl melted her cornea. For those of you who don't know what the cornea is the black parts. You're looking at me right now, right? I'm seeing you guys on Facebook. Cornea is the black part, right? This lady melted the cornea. Now, the leaf that she instilled, it was so acidic that the entire integrity of the eye, like my eye as you're seeing me now, shrunk. The entire skin here shriveled. That's to show you how acidic the leaf she instilled into her eye. And that is the last topic I want to talk about, the last point. Do not instill leaf fluid, whatever leaf, stick, whatever thing. I'm going to do a series on that, different leaf people put into their eye. I've heard about scent leaf, I've heard about pawpaw, that white fluid, I've heard about that. And I keep wondering, why do we have to put all those things into our eyes? Why do we have to do that? And this 25-year-old girl who entered this year with both eyes that could and can see is currently blind just because she listened to her neighbor instead of going to the clinic. Do not instill whatever herbs they tell you to instill into your eye. I've heard people say you can melt cataract. You don't have to go for surgery for cataract. You can melt cataract. I've had a patient come to ask me if it's medically correct, if it's right that they use these particular herbs to melt cataract. My question to her was, where is cataract located? And she doesn't even know. So let me say this to you, that somebody can come and tell you to buy something and instill in your eye, it's going to melt cataract. Cataract is not on the outer part of your eye. Cataract is inside. Cataract is the lens that is inside your eye when it turns white. So if you want to melt the lens that is bad, that's the bad lens inside your eye, that means you have to melt the outer part of your eye to get inside for the cataract to melt. Based on they are using eye drop to melt it, right? So when you finish melting the outer part of your eye and then getting to the lens and the cataract melts, how do you now repair the outer part of the eye? That's the question I expect people to ask people. Ask them these questions. I'll give you an eye drop, it's going to melt. I don't know, melt the cataract. I'm not saying that whatever doesn't work. I'm just asking, can they try it on their own eyes and see if it will melt the lens first? Because cataract means that the lens in the eye is not good. So if you want to melt the cataract, that means you have to melt the lens. So can they try that? See guys, I can say all these things. I can go on and talk about so many things we shouldn't do and the ones that we do. But the truth is this: many of us know. We know what not to do. But sometimes, like there's a post I made earlier and I talked about self-medication, and I asked people, what do you think is the reason behind self-medication? And I got lots and lots and lots of answers, from poor healthcare system to lack of funds to lack of awareness, lack of information, and all that. We can say so many things. Some even said bad governance, right? Somebody even went ahead and told me I should blame the president. The truth is this: we can blame the whole world. We can blame everybody except ourselves, because we are good at that. Your eyes are your responsibility. That's the fact. It is more of your responsibility. I get concerned because if you are blind, it affects me somehow. Poor vision leads to poor productivity. Poor productivity leads to poor economy. Poor economy affects me, affects every one of us. So the much I can do is to create awareness on the importance of early detection. You don't have to wait. There's a patient I saw today, not yesterday, but today, a 65-year-old man whom I had to tell that medically his eyes, they are gone due to glaucoma. I had to tell him that, and that's one part of my job I hate doing. Telling somebody medically, your eyes are gone. And the man told me that he began to notice that the vision was not okay 13 years ago, but he didn't see it as anything because there was no pain, no itching, nothing, no sign. And that is the issue with glaucoma. Glaucoma is called the silent thief of sight because it does not give any pain. I told him, well, you could have, that's why we try to get people to come to the clinic. He now said that he can't just get up and go to the hospital. There has to be a reason. I said, well, when it comes to the eyes, you don't need to wait for a reason. You don't wait, because most times you will have no reason to come. Just the fact that you know that you need to come should be enough. Don't wait for signs. Don't wait for symptoms. You may not get it. You can just wake up and find out that you can't see anymore. And that's the hardest part. So, if you have family history of somebody wearing glasses in your family, have gone for any eye operation, people that have diabetic hypertensive, you are hypertensive diabetic, or you spend a lot of time on your phones, please find time, make time, create it if possible. Go and have your eyes examined. That's all. Let it be that the doctor tells you, okay, you're fine. Let me see you in a year or in 2 years, depending on your age bracket and your visual lifestyle. But do not ignore it and say, let me wait until there is sign. So, ladies and gentlemen, tonight is very simple. Like I said, I won't take much of your time. I just wanted to bring this to your consciousness. And then to ask you, what price tag are you placing on your vision right now? What price tag are you placing on your vision? Are you being intentional with how you see, how well you see? Have you ever woken up one day and closed one eye and the other to see if you're actually seeing well? Have you taken a look at your eyes to see if they are symmetry, like I'm looking at the screen right now and they look straight and all that? Are yours like that? What price tag are you putting on your own vision? So, if you're just joining, this is EyeCare Online, episode 17. My name is Dr. Doris. And yes, we're rounding up. So thank you to everybody on Instagram. Olga Glory, thank you so much. Bumi, thank you. Ask Dr. Ada, hey, baby girl, thank you so much. Thank you guys for joining. David, I can see one of my admin, my team. Okay, you guys are up. All right, thank you. Ajoke, thank you so much. Oh, Olabatunde, oh, thank you so much. Thank you guys. So if you have any question, you can drop in the comments. I'm going to respond to that. And yeah, basically that's all for tonight. Okay guys, so let's have a good night's rest, and I promise I'll see you guys next week Monday. And for now, I'm gonna share some amazing content during the week. There's some things I put together for you, and if you have not yet subscribed to the newsletter, please, if you're on Instagram, check the link in my bio. Every Sunday I send you something that you can actually implement during the week to get you to be intentional with your vision and with your sight, because sight is wealth. If you're on Facebook, there's a post I made on Sunday about the newsletter, so find the link and subscribe, and I promise you the newsletter is going to be brief, just to the point, what to do, what not to do, and that's just to keep you, keep your eyes healthy. Thank you so much for being part of this episode, and let's have a good night rest. So let's end Instagram first, and then